Amy Jones, LCSW, Clinical Director here at Lighthouse Recovery Institute. I'm going to share with you a little bit about one of the groups that we run here. So I love running groups on mindfulness. It is one of the main components of dialectical behavioral therapy. Dialectical behavioral therapy is really about finding two apparent opposites, both being true at the same time, using and instead of but. So for example, you're doing the best you can and you could be doing better. So back to mindfulness. One of my favorite groups is to run the what and the how skills of DBT and mindfulness. The what skills of becoming mindful are observing, participating, and describing your experience in the activity that we do within the group. The other is the how skills of mindfulness, which are non-judgmental, one-minded, staying present in the moment, shifting your mindset to right here and right now, and then effective. And one of the main things with dialectical behavioral therapy and teaching the skills model of the what and the how is oftentimes effective means doing what works best for you. So if the activity is a meditation, and what may be effective for you is to keep your eyes closed during your meditation so you can feel connected and centered. DBT traditionally encourages you to keeping your eyes open or finding a low gaze on the floor to minimize distractions. But one of the main components of DBT to keep your eyes open is so that it's easier to translate those skills in everyday life. So we do various activities of utilizing the senses of sight, taste, smell, to really begin to utilize what mindfulness really has to offer for you, and so that you can live more peaceful in the moment.